There's one thing I want you to get right now. So if your labor stalls, and we're going to talk about 6 centimeters, but if your labor stalls, the last thing you need is pressure to speed it up before you've tried working with your body. So these are simple, safe, body-based moves. And today I'm going to teach you nurse-tested, spinning babies inspired techniques. We're going to learn the jiggle, the forward-leaning inversion, and the sideline release, plus the lateral jiggle and shake the apples, and a tiny sacral nudge that often frees a stuck baby. And I'm going to give you exact setup steps, partner cues, timing, and words so that your person can say, so nobody is panicking in the room, even if you're exhausted. Even if someone already suggested Pitocin or C-section or induction, you still have options. I'm Trish Ware, labor nurse mama, and a labor and delivery nurse for 16 years and a mom to 7. So I want you to save this video or podcast, however you're watching it or listening, and I want you to practice this so that it's automatic when labor gets loud. Okay, there are some warnings that we're going to put in the show notes that if you have certain conditions, or if you're even questioning, if you have any kind of high-risk diagnosis, make sure you talk to your providers before you do anything that anyone recommends, always, because I'm not giving you medical information, I'm giving you educational recommendations. So quick physiology. In plain English, labor works when your hormones and your pelvis cooperate, and the baby. Oxytocin makes contractions effective. And the last episode, we talked about mindset and how adrenaline can actually stall or stop your labor. So go and listen to that one first before this one. Adrenaline short circuits oxytocin. It's like the enemy, and baby's head needs to rotate into an optimal angle, usually what we call OA, which is occiput anterior, to descend into the pelvis. And if the baby is posterior or transverse, or what I call wonky, maybe against your sacrum, or your contractions might be happening, scratch that. Or maybe the baby's like braced against your sacrum, your contractions can be strong, but ineffective. So they're like, but nothing's happening. I hope you guys like that. Right? But nothing's happening because they're ineffective because the baby is not moving. Small changes in your positioning plus some gentle releases of your pelvic joints and your fascia create new geometry for baby to get their little booty, actually not the booty, get their little head into the pelvis. And when you pair those moves with your calm breathing technique I taught last time and grounding touch, your body has a much better shot at using the space. So we're going to keep this practical. We want to do these in sequence: a short jiggle, a forward leaning inversion, then a sideline release. Add in the lateral jiggle or shake the apples as some micro movements. Use my calm sequence before each set where you breathe and you have some anchoring touch and some grounding phrases. I want you to always stop the negative thoughts and tell yourself how powerful you are so that your nervous system also cooperates, right? So we're going to start with the jiggle. The jiggle is a light rhythmic oscillation to your upper thighs, your booty, your glutes, and your lateral pelvis. It's not massage. It's a gentle vibration that tells the fascia and the muscles to relax. So you're going to lay on the bed on your side, or you can sit on a birth ball or lean forward over a bed, and your partner sits behind you or alongside you and uses the pads of their fingers and the heel of the hand and gives short little steady jiggles, right? Think a gentle buzz, like a calm laugh, not a shake. You're not like, yeah, it's short. It's more gentle. 1 to 2 minutes per spot is fine in labor. If you use it during a contraction, time the little jigs on an exhale and relax on the inhale. And your partner line is little jigs on the out. I've got you. Stop if you feel uncomfortable or dizzy or any other concerns. The next movement would be the forward leaning inversion. And this is not like, this may seem like it's some kind of stunt move, but it's a gentle gravity assist. Again, if you have high blood pressure or any kind of high risk, anything going on, talk to your providers first. So you're going to kneel on a couch or a bed. We have the couches in the labor rooms. And you're going to walk out on your hands. And we're going to show you this. We're going to have a video in here to show you that. If you're listening to this, You can Google it, or you can come to our YouTube channel and watch the forward leaning inversion. And so what you're going to do is you want your hips higher than your shoulders, about a 15 to 20 degree tilt. And you're going to hinge forward, right? And your hips lift above your chest. And you hold this for 30 to 90 seconds between contractions. You can do gentle little pelvic circles while you're there to keep your circulation. And your partner should be there with you. And 60 seconds, breathe with me. And this creates posterior space behind the baby's head and often loosens a posterior lock where the baby's just jammed, right? And helps. If you feel faint or if you feel off, go scale back and don't go as forward. Now, the sideline release, or the SLR, this is a focus supported release of the sacroiliac and your posterior pelvis that lets the baby roll forward. So you're going to lay on your side with your hips and shoulders stacked. So they're lined up, hips lined up, shoulders lined up. You can then lay the top leg forward off the bed. So the top knee bends and drops slightly forward. Your partner stands behind you and supports you. So when I do this with a patient on the labor bed, we get all the way to the side that the leg is going to drop over. You can have your partner support the top leg at the knee and the ankle, and a hand near your sacrum for support. The release has 3 components. And again, we're going to have some video, and we're going to tie to images and what have you, so you can see this. The first component is a soft traction where the partner lifts the top knee lightly toward the shoulder and slowly lowers. Like, think lengthening, not force. 2 slow circles with the top knee, about 10 slow circles per minute. And then the third part is a tiny sacral micro release where the partner places a palm on the sacrum and gives a gentle posterior nudge on the exhale and releases on the inhale for 6 to 8 soft reps. And they're going to do this about 3 to 5 minutes per side. So you want to watch the video on this. So go to my YouTube channel and look for this episode. Your partner is going to talk you through it. And if it hurts, stop. If you have some kind of severe pelvic instability, you should not be doing this. Or if your provider advises otherwise, again, always talk to your provider. I can't stress that enough. And combine those 3 in a quick flow. 1 to 2 minutes of the jiggle, 60 seconds of the forward leaning inversion, then 3 minutes of sideline release on each side. Okay. Finish with my calm sequence that I taught you last week, which is inhale 4, hold 1, exhale 6 with a grounding phrase. My body knows how to birth my baby, and repeat as needed. This sequence primes tissues, uses gravity, and opens the sacrum in a way that often gets the baby unstuck, right? So a couple of powerful micro moves that I want you to add in to use throughout your labor as well is the lateral jiggle and shake the apples. The lateral jiggle is a rapid, light, like oscillation of the upper sacrum or the lateral pelvis. It's similar to the jiggle, but it's more targeted. And the partner rhythm is short and quick on the exhale for 10 to 30 seconds. Keep it gentle. If mom says stop, stop. And you can encourage her and give her powerful affirmations throughout. Now, the shake the apples is a playful, like soft 10 to 20 seconds of pelvic vibration. And you're going to stand over her. And I'm going to show a video of me doing this with Ashley during her labor. And you're going to jiggle, right? I've got a couple videos for you guys. So you should be on your hands and knees, and your partner is going to use a rebozo or a towel or a blanket, and they're going to vibrate your pelvis, basically like shaking apples off a low branch, right? So you're just shaking lightly. It prompts tiny rotations when the baby is like not getting with the program. So your partner can support you. Again, this is not force. It's a quick little nudge. And again, if you feel uncomfortable, stop. Now, there's one other tiny tool that I call the sacral nudge. After SLR, partner places palms on either side of the sacrum and applies a rhythmic pressure backwards on the exhale and releases on the inhale for 6 to 8 gentle reps. This is like not force, right? It frees a small posterior lip, which means the baby, like your cervix is like dilating, but you still have a little bit on the posterior side. Your partner is going to be tender and stop if you are uncomfortable. A few rules that matter more than the perfect pose is you start gentle, move often, and use short cycles. Baby responds to repeated, subtle angle changes over time, not one thing, right? So open the pelvis, And, use some low guttural moans that actually opens the cervix and it relaxes the pelvic floor. Humming or low sounds also increases the oxytocin. Repeat these positions for several cycles, and you can ask your nurses to do this with you. All right. Remember, your nurse is your bestie. If she's not, you need to ask for a new nurse. And you have so much that you can do to be proactive during labor and get through your labor where you're not just like, oh my gosh, I have to get through this. You're actually participating. You actually have knowledge and power. And these are things that I teach inside my classes. And we have our Calm Birth Bundle. And you can add on to the Calm Birth Bundle our Purposeful Positioning course, which has all the videos for all these things. We show you positions to use during pregnancy, during labor, and during pushing, whether or not you have an epidural. So these are all adding into your experience so that you're not just like showing up and saying, hey, teach me what to do, because that is going to increase the adrenaline. When you don't know what's happening, you freak out. I promise you, you will freak out. So make sure that you are learning positions, learning mindset strategies, and bringing a full labor tool bag into the labor room. Practice this with your support person so that they feel confident as well. And we have a link to the full birth classes. You can go to learn.labornursemama.com/calm, CALM. And once you check out, add on the purposeful positioning. You get it for a really low price during checkout. Okay. And we have full walkthrough videos inside there. But before we close, I want to bust a few myths. You don't need to be a gymnast to use these moves. You don't need to be an athlete. Girl, I am not an athlete. These are just simple modifications for everybody. Positions and releases and mindset technique all work together to help the baby move and to help you calm down and increase the oxytocin. And again, these are tools to try so that you avoid the cascade of unnecessary interventions when it's safe to do so. So practice it, work together. I am just so proud of you for seeking out education. That is such a powerful start. And if you want the full video demos and all the things, enroll in the classes, add in the purposeful positioning, and then I'll see you a few times a month on Zoom where we do our pregnancy happy hours with our students. So, and I'll answer your questions there live and get to know you and help you create the best birth plan ever. Okay, you guys, thank you so much for listening to this episode. I know it's a little hard to talk about positions if you're listening to it on the podcast, but this is really valuable information and you can actually communicate it with your nurse as well to do these positions during labor. You are so incredible. I'm so happy you're here. As always, hit subscribe, leave a comment, write a review, depending on where you're listening or watching this episode. We love you. We adore you. You are so powerful. And I will see you again next week. Bye for now.